What's going on, everybody? Welcome to another edition of the Strength and Knowledge podcast. I am very, very happy to bring somebody today who has been an intern with us and who we really have just been able to see her trajectory take off over these past few years. She actually grew up locally to where I grew up here in Maryland, went off to Miami for volleyball for a little while, ended up staying at Miami for DPT school and is now out in LA. But I'm very, very excited to bring to you today, Mariel Schofield. Welcome, Mariel.
Hi, Josh. Thanks so much for having me.
Absolutely. So, a big part of you, and I think where you're at now, can be attributed to your upbringing, the experiences you had through childhood, some of the things that you were exposed to, some of the things that you've honestly just experienced and been a component of the healthcare system in itself. But I think largely it's shaped your philosophy and probably most likely the business in which you're working at today. So talk to us a little bit about your experience as a young person and your first encounters with the healthcare system.
Yeah, for those who don't know, I'm type 1 diabetic, and I was diagnosed at the age of 5. And that was a large influence in helping me decide, like, where do I want to go with my career in healthcare. I was told from a very young age to be sheltered in a way. I wasn't given very many strategies from a lifestyle perspective to be healthy and take care of myself. And I was pushed more of this magic pill where all I need to do is take the medicine that I'm given, and there was no discussion on like nutrition and training and more of these controllable variables that really influence our physiology and make us healthy. So that really influenced my, I guess, desire to learn more about the human body and learn more about what I can do to live a healthy lifestyle and be resilient rather than just taking a pill and relying on that. So yeah, I decided to go to physical therapy school, and that would allow me to put myself in a position where I could be part of a team, a multidisciplinary team that is now Monarch, to help better influence people's lifestyles in a more comprehensive way rather than try to sell a magic pill.
Yeah, and I think when I hear your journey, I can draw some parallels with regards to my experiences, although different, similar with regards to my early experiences with the healthcare system. I had eczema growing up, and I remember being told over and over and over again that I would need to have this steroid medication applied to my elbows, the sides of my hips, the under parts of my arms, during the winter months, probably for the rest of my life. And it wasn't until that I experienced a group of professionals that viewed things outside of maybe an isolated cause of an effect, where I got to the point where I realized that there were certain either instigators or agitators that were creating this inflammatory response. When I take that over to the musculoskeletal world, I think we're going in a direction where we're talking about a lot more than just pain in itself with regards to this structural reason, or maybe a singular mechanism. What are some maybe areas in which you've had exposure through your time as an athlete, or just aha moments where you realized that there was a lot more than maybe these quick fixes to pain?
Yeah, I think my aha moment was my junior year in undergrad. I was playing volleyball for the University of Miami, and I kept getting sick. And there was a period of time where I was in and out of the hospital for maybe like once a week for 2 months. And a lot of it had to do with blood glucose dysregulation and the side effects from that. And my athletic trainer was like, I think you need to explore this a little bit more. Like, you need better solutions, better strategies from like a nutrition perspective and a sleep perspective. And let's look at all of these different variables that play a role into how your body's going to function, rather than just checking your blood sugar and giving yourself insulin and maybe metformin. So that was kind of my aha moment. That made me realize, like, hey, there's more to this than just um, following this protocol of treatment. And that's what made me really dive deeper into like physiology and exercise physiology and nutrition, and learning more about how can I better take care of myself.
And I think when you touched on a couple different things there. You're viewing this in different buckets, so to speak, right? You're trying to find areas in which maybe you can pour a little bit extra or avoid the depletion of some of these buckets, but ideally viewing them more from a collective standpoint as to one that's singular. When you talk about things like sleep, you talk about movement, talk about nutrition. I know those are three big pillars of what is going on at the current, business and company of which you work with. That is Monarch Athletic Club, located out in Los Angeles. Can you share a little bit about what drew you to Monarch, and maybe a little bit about just what goes on within the four walls there?
Yeah, so Monarch is a really unique team, and I love that. I love the fact that we're a team of different healthcare providers. We have medicine, physical therapy, strength and conditioning, and nutrition all under one roof. So each member who comes into our facility gets a medical eval, they get a PT eval, they get a 2-day strength assessment and a nutrition assessment. And we're really trying to figure out, every little detail about this person and how they think and what their habits are, and how can we provide solutions rather than instilling fear and telling people that they're broken. So what drew me to that is, I think, my history in athletics. I knew I wanted to be part of a team. I think that collectively we can achieve a lot more than what I can just do by myself as a DPT. So I went to PT school, and I remember speaking about this in my interviews. I was like, I want to create something that's multidisciplinary and something that's more collective than um, just being a specialist in my respective field. And I distinctly remember University of Delaware and even at University of Miami, they told me that that would never happen because our insurance system would never support something like that. And I was like, okay, I guess I have to be cash based. But um, yeah, we're really making it work, and it's been really, really rewarding to see how this teamwork approach affects each individual, and it's really empowering. I believe we're able to achieve a lot more from a global health perspective than just, getting 2 to 3 visits a week for 8 weeks of physical therapy and thinking that that's going to make a difference.
Yes, I think especially during a year like this year, I mean, we keep hearing maybe these phrases like public health or population health or the word vulnerability thrown around. And I think that there are so many different ways that you could probably view each of those respective phrases or words. If I get into a little bit what you were alluding to, which is like the siloing of different, professions, I always think about much more of a traditional medical model. One of the things that drew me to creating Rehab to Perform was my experience as a college athlete. I thought it was incredibly synergistic. There was a lot of collaboration of care. I was actually just talking to somebody on an interview this morning, more related to my brother and what had gone on at Maryland with regards to the ability to coordinate care even outside of there, just as I was involved with his rehabilitation process, but just appreciating having people under the same roof definitely can make stuff easier. Obviously, there's still some challenges, all depending on the dynamics of the people, but there's no substitute for like having the physician, the AT, the PT, the sport, position coach, like for him, his running back coach, the offensive coordinator, the head coach, all of these different people being under the same roof, but also recognizing sometimes that just because of proximity doesn't mean that we're necessarily going to have that coordination of care and that synergy as well. Sometimes, and I'm not saying that happened either in my experience at Ohio State or at Maryland, but I have heard of situations where egos will get in the way. If we draw this parallel over to physician-owned physical therapy practices, I think there's been plenty of literature to support that really there's not that much communication that goes on. There's not an increase in regards to collaboration of care. So what are some things that you think that Monarch is doing that we could all take from that really hammers home the importance of communication and collaboration?
Yeah, I think you're right. I think there is a lot of ego within our medical system. And what I really love about what we're doing at Monarch is we have really embraced this teamwork approach. In order to be a team, you need to recognize how valuable each role is. And that's what we've done a really good job of is being very respectful to each individual department and having this growth mindset. Like, am I asking questions to better myself that will allow me to make a better decision for this patient? And um, rather than trying to be the most respected leader or egotistical, I don't know, um, person in your department. So I think that at Monarch, we've done a really good job of growing together as a unit and asking questions and always almost not calling each other out, but asking questions to learn more about what this person believes and why they believe it and what can I take away from that. So that's been a really unique experience at Monarch. I think that um, also it's communication is the most important thing that we have to provide at Monarch. So we always have rounds twice a week to discuss like who is this person, how do they present, what are their limitations, how can we better, you know, make decisions that will allow them to get to where they want to be. So I don't know if that makes sense, but
Not
I guess
perfect.
communication is the most important thing and just understanding what your role is and what you have to contribute and how can you be the best at that as a team.
And sometimes it's just providing opportunities for it, right? So you're carving out time for rounds. Um, when you have those one-on-one conversations, even when you're asking questions and coming about it in a way that at least is making the other person defend themselves. You called it maybe calling them out. There's a certain level of accountability that goes into having to explain something. I think those are all great touch points. Recognizing our limitations, as you mentioned, not being multidisciplinary, but trying to make sure that we are interacting with all of the disciplines. Uh, you know, Having certain forms, having certain educational materials that you can pass with people. The biggest thing is the initiation of the conversation. But I love how you mentioned that nobody's role is more important than the other. I think that's tremendously important. I will even go as far as to say we need, as I sit here at our front desk, like we need our clerical staff just as much as we need the PTs in order to make sure that everything gets done the way that it's getting done. This end-to-end experience, making sure that things are seamless, that there's no drop off. I think if I'm talking about their role, their ability to ask questions, hey, where are you coming from? Who do we need to have a conversation with? If we need to have a conversation with that person, you need to fill this form out. That automatically loops them in with regards to coordination of care. But the other thing that I think about when I hear collaboration as I think of the word overlap, and I think of like a Venn diagram where we at least need to have kind of this superficial understanding of what's going on in some of these different areas. Not to say we need to be specialists there, but if we're at least a generalist in the other categories, we can have more of those productive conversations. Nutrition being something you're familiar with because of your upbringing with diabetes, but mention things like sleep. I know you have a functional med physician in there. Is there anything that you would recommend to people listening that you think are very easy to implement recommendations that they could have to people that they're working with, say in some of those categories we just mentioned?
Yeah, you mean strategies to create better habits, like sleep
Yeah,
habits,
sleep,
things like that?
nutrition. What are some things like? Is this just conversations? Are there materials? Are there, is there anything from a like a journaling standpoint or something that you're implementing at Monarch that you found to be particularly effective, or just a thing that you wish people would have a conversation more when they're interacting with the people that they do?
Yeah, I think it starts with self-awareness. So being able to identify like what are these habits that I do every day and um, what are simple and cost effective ways that I could just be a 1% better. So in terms of sleep, like my favorite ones are limiting screen use at night, which is really hard to do, especially with like Instagram and Twitter and all these social media platforms. Um, at least 1 to 2 hours before you go to bed. So for me, like the number one habit that I've prioritized in my routine is how can I sleep better? Because if I can't sleep better, my blood sugar is going to be affected, my stress hormones are going to be affected, and it just doesn't allow you to recover and adapt. And if you can't recover from all these training adaptations that you're inputting, then you're not really going to make positive adaptations. So, in terms of sleep, my favorite ones are limiting screen use. If you do have to supplement with melatonin, I think that can be an appropriate um, addition to your sleep routine. I think incorporating some breath work to help calm down your nervous system is very valuable. Um, and I also use like a white noise machine that helps limit, like, I live in a city, so it's very busy. You hear people honking their horn all the time and people partying and whatever. So having something that will allow you to not be woken up by a loud noise, I think that really helps as well. And also darkness. So having blackout shades and um, making sure you're in a very dark environment can also help, and temperature. Um, so from sleep, those are my favorite ones. I think from nutrition, eating a very whole food, even plant-based diet. Dr. Green, our physician, is very big on nutritional inputs. So making sure that every food that you input into your body is sustainably sourced. There aren't a lot of processed or refined sugars, things like that, that can also help from a nutrition aspect. Um, I'm trying to think of what else. I think journaling is
Yeah.
very valuable too, like tracking what you eat and tracking like your activity. And um, there are a lot of wearable devices too that also keep you accountable, like Whoop and Aura Ring. And they may not be the most accurate in that moment, but how can I identify trends over time that help reinforce a more active and healthy lifestyle?
I think the best part of the things that you just mentioned is they're pretty much universally applicable. And one of the things that we have been working on more and more and more is if these things are universally applicable, yet there's a percentage of the population that does not know that they're valuable, how can we make sure that those touch points are occurring more and more often? So, utilizing technology, utilizing all of the different modes of media that people will utilize: YouTube, an email newsletter, social media, apps, this multimodal exposure to ideally ensure that the conversations going on, although we are predominantly a physical therapy company, that people are having overall wellness related topics exposed to them, and ideally information put into them that is very, very, very easy. As you mentioned, I love like simple strategies to complex problems sometimes are tremendous. And a lot of times you'll hit those low hanging fruit where somebody's just having just sleep issues. Okay, you keep coming in, and every time you don't sleep well for 2 to 3 days, well, research has shown this, but you're also reporting it. Your pain levels are higher. You're having more discomfort in your back, right? The balance between under recovery, right, or too much of whatever we're doing, but appreciating the fact that oftentimes that under recovery bucket is largely due to all of the things that we're doing outside of that more physically focused session that we're doing. For you in particular, I know you mentioned type 1 diabetes earlier, and that's something that you've always dealt with. I do think that, at least with regards to injury and things like, say, back pain, that maybe there are some things that people are not aware of with regards to delayed healing or just collectively affecting the individual. So for anybody that is working with somebody that has type 1 diabetes, let's say they're working with somebody that's post-op, what are some considerations that should be different for that particular situation, or maybe things like low back pain or anything else that comes to mind?
Well, I think the number one um, factor that is the most important is, are you regulating your blood sugar? And if you're not, if your blood sugar is constantly fluctuating or if it's elevated, that's really going to hinder, you know, tissue healing. And like you said, it can create this cascade of like pro-inflammatory events that our bodies don't really like. And encouraging somebody to either get a continuous glucose monitor or be checking their blood sugar regularly, and being able to adapt, um, rather than let it stay elevated for too long, is going to help your internal environment succeed. But yeah, I guess delayed healing times are the most common repercussion of not managing your blood sugar well. And it it really affects every aspect of your life. Like when your blood sugar is dysregulated, it affects your emotion. It makes you grumpy, it makes you irritable, it makes you not sleep as well. And I think sleep is probably the most important thing that we have from a recovery perspective. And I talk about it a lot with my patients. Like, if you're not giving yourself the inputs to sleep well and manage your blood sugar, then you're not setting yourself up for success. Um, yeah,
Yeah,
that's all I
no,
can say.
I agree. And those kind of go hand in hand. Say things like pro-inflammatory, sleep issues can lead to systemic inflammatory changes. Obviously, you mentioned issues associated with blood sugar. Nutrition can affect things with regards to inflammation throughout our whole body. I think when you bring up things like COVID this year and you hear about this cytokine storm and the relationship that inflammation has in that particular situation as well, I think that's an area that a lot of people can be at least having some superficial conversations about more and more. But Mariel, to wrap up today, I want to talk a little bit about your role, particularly being a female in healthcare, a female in physical therapy. They're definitely being more and more focused on equality, not just in society, but even in our field. Recognizing that there's probably a lot more prominent male figures as it relates to a lot of the different speaking, engagements going on in business roles. What are some things that you would say to other females in the profession, especially some of the younger females in the profession who are looking to make a mark similar to how you are?
I think I don't even like to think of myself as, male versus female. It's just, how can I prepare for a better future self? How can I be better? How can I do things every single day that will make me a better human, a better physical therapist, a better, um, I don't know, sister, and all of these things. And I think having that confidence and being able to adapt and grow from every little situation that you experience is really important, and having that growth mindset. Um, that would be my, I guess, best recommendation. It's like, view everything as a learning experience, and you'll learn a lot as you grow.
Yeah, and I can say for me, I mean, it's just been awesome seeing you grow, push into episodes of discomfort. I'm not going to name them, but some of the experiences you've had where you've been less pleased, and watching how you've handled those. Also, being able to be a part of some of the discussions as you solve a lot of these issues or things that have popped up yourself. So, obviously, you hate to sit here and back and like say it's, you're super proud of somebody, but it's always cool to see people and their trajectory from spending time with us as an intern, and then to seeing what they're able to do in the years that follow. So just super excited for you. Very, very happy that you seem to be happy in your role at Monarch. I know that we set up a course that we had been talking about pre a recent shutdown in LA. Obviously, we're going to continue to monitor that, but regardless of when that ends up happening, we're very, very excited to come out to really just honestly see the space, meet some of the other people that you share your day-to-day life with, and deliver our blueprints course. But for people that want to stay in touch with you, reach out to you, maybe have some questions for you, where are the best places for them to interact with you?
I'd say Instagram is where I'm most active. So either my username is Dr. Mariel, and or Monarch WeHo. So those are the two platforms that I help manage and oversee, and those would be great places to reach me at.
Perfect. Thanks for your time today, Mariel.
Yeah, thank you, Josh.